So information is critical. Let's start with the average person. Look, we all have different personalities. Some are more prone to panic than other people. But besides those tips from the CDC, what can you tell people to sort of calm their fears? What's within their control? Because the feeling is in situations like this, so much is out of our control.
Right. And I think one of the mistakes people make in our positions in the medical community is to say, well, use common sense. I can tell you, seeing patients every day, that there's a lot of variations in what common sense means. I see people who are becoming very fearful right now, and they're stockpiling food, and they're not going out of their house. That's not how I'm behaving. I am trying to be vigilant, but I'm also living my normal life. I took the subway here. I'm not wearing a mask when I go around. I'm washing my hands with soap and water multiple times a day. And when I cough, I'm not putting my hands over my mouth. I'm putting, like I'm dabbing here, because I'm trying to protect other people, and I don't want to go and shake hands. And I see people who now, when they shake hands, you see, it's sort of alluded to what the president said, that they're a little hesitant. And I think that we may see a change in culture where we stop shaking hands, frankly. But really, soap and water, cover your mouth. It's really hard to avoid touching your mouth and eyes. But that's really the recommendation.
We always say this, Dr. Rob, but in situations like this, anybody who's immunocompromised, anybody who's already sick is obviously, it's more likely that they will be impacted by this. What can people in those situations do? Do they need to take those extra steps of precautions, even though, again, the only case that we know right now that we can't account for the source is that one in California?
So the same things that you're going to do to try to protect yourself from other viruses like flu are going to help protect yourself from this new virus. So stay away from people who are sick. If you know other people who are sick at home, try to stay in a separate room from them and do all the same things that, as my colleague here mentioned, you want to be washing your hands frequently. And if you can, try to avoid going out in scenarios where you're potentially going to be coming into frequent contact with people who are sick.
But both of you would fly right now.
Right.
Yes. Yeah, no problems with that.
Cruises are a different story.
Oh.
Now, I think the situation with cruises is evolving. If I have relatives who are 80 years old and have a cruise coming up, I might tell them to hold off. We're seeing that, this virus affects people differently. And high-risk people are those who are over the age of 80. If you've been on a cruise ship, you're at risk. And so I think we're going to see that question continue to evolve as well.
One of the things, and you and I touched on this at the beginning of the hour, New York City Mayor Bill de Blasio, and we've seen a lot of cities and a lot of mayors talking about their own preparations. He wishes he'd see a little more urgency from the federal government, and I want to play for you what he had to say this morning.
The federal government does need to speed up, step up in terms of making the testing available locally, so it's not always waiting on Atlanta. Making sure that things like surgical masks get where they need to get around the country, making sure there's resources for local areas that can't afford, to put people up in hotels if they need isolation. It can be done. So I'd like to see a little more energy on the federal side.
You and I already talked about testing and how we need to have more point of contact testing. But what else would you put on your priority list that's needed right now? Like if you've got a wish list and this has to be number one, number two, number three, what would it be?
Well, I'll tell you, before I came on, I had a call from a senior official at the Pentagon who said the Army's ready to mobilize. And so, while Mayor de Blasio's point is well taken, and I think he hit the nail on the head of what we should be focusing on, I do see an urgency now with the federal government that I didn't see 5 days ago. So I am seeing the pieces fall into place. They're saying the right things. It's just a matter of actually making it happen. And so we hear about the point of care testing, and then there's vaccines that are coming along, the drugs and the clinical trials. The pieces are there. It's just a matter of letting it happen and making sure everyone stay informed.
I feel very lucky that I live in a major city that has extraordinary health care available, literally within blocks. If you don't live near a major medical facility, how concerned are you? How concerned are people in the medical profession that, frankly, folks who don't live in major urban areas are going to have potentially a tougher time than folks who live in New York City or San Francisco or Los Angeles?
Well, the good news is that from the data we're seeing coming out from China, over 80% of cases seem to have mild symptoms. And so those might be people who don't need to access medical care, who are able to stay at home and monitor and manage their symptoms just with supportive care at home. But for people who don't live close to a major medical center, a lot of health systems have now come up with ways to have virtual visits so that you can contact a doctor from home. And so if you live in a place and you're not sure what to do, call your doctor before you go. Tell them, I'm having these symptoms. Do I need to do anything special? Should I come in? Should I not come in?
Dr. Rabb, Dr. McCarthy, I feel better after hearing from both of you, so I really appreciate you coming in. Thank you so much.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.